Hey guys, it's Dr. Rob from True Health Wellness Centers. I want to talk to you guys about headaches. Are you somebody who's ever experienced a headache before? Even worse than that, are you somebody who's ever experienced a migraine headache? If you are, you understand how debilitating that can be. And I want to talk to you about how it is that happens and what it is that we can be able to do to help. You see, in order to understand what it is that happens, we have to look at the anatomy with how everything is designed right inside the neck area. And so if we look at how your spine is created or designed, we're designed so that in your neck, you should have these bones right here forming a curve inside your neck. As long as there's a curve like that inside your neck, if you're pointing at that direction right over there, then there's going to be plenty of flexibility and plenty of space in order for gravity to literally be pushing on your neck right here in order to be able to allow those nerves some breathing room to get to where they need to go. That's important because the nerves that come out of this area right here are the nerves that innervate the blood supply to the head. It's when the blood supply to the head, those blood vessels dilate, that you actually get a headache. Now, if I move the spine out of alignment so it looks like this, or we move it like that, you can see that it's now going to stretch the spinal cord out, and if we're stretching the spinal cord and putting stress on these nerves, they're not going to get to where they need to go to at 100%. And if they can't do that, that can result in a headache, or even worse than that, a migraine headache. So here's what it would look like if we're looking at you from the side. You can see that this right here is where your head is. This right here is where your neck should be. You should have that curve like that. This is what it is that we're talking about. If you lose that curve, the neck goes straight and looks like that, stretches out the spinal cord. If we're looking at you from back to front, and your shoulders should be straight across like that, as a result of slips, falls, motor vehicle accidents, even just poor posture, it causes the spine to look like this, which then causes the neck to start to bend like that, causing problems or pressure to these nerves inside here that go up to your head, and as a result, you get a headache. So what do we do about those? Well, the first thing that you gotta do is you gotta get checked. You gotta find out exactly what your spine looks like, exactly what your posture looks like, exactly what these bones inside your neck, what they look like, and the only true way to know what that looks like is to be tested for that. That's one of the things that we do here at True Health Wellness Centers is we test for these misalignments to the bones that we call vertebral subluxations to see if they're putting pressure on the nerves that could be causing the headache or the migraine headache. Once we've tested to see exactly what that looks like, then we can develop a program that's customized and right for you so that you don't have to live with those headaches or those migraines anymore. And so once we see exactly what's going on, we go over the program with you, then we can really know how to be able to help you. Again, my name is Dr. Rob with True Health Wellness Centers. We'd love to see you. If you're curious and you want to see if we can be able to help you, all you got to do is go to truehealthmidcities.com. That's truehealthmidcities.com and click the Book Now button. When you press that Click Now button, that allows you to be able to come into the office at a discounted evaluation to be able to see if we can be able to help you. Have a great day.